Hello, I'm Matthew Balti with the Acoustic Neuroma Association. I'd like to welcome everyone to today's ANAwareness Week presentation on roles of the patient, patient navigator, and provider in the AN journey with Dr. John Ogilvie and Jennifer Kelly with Keck Medicine of USC. We'll begin shortly, but first a couple of quick items. Captions are available for this presentation at the bottom of your screen. This presentation is part of our ANAwareness Week, so make sure you stay connected to the ANA through our social media pages on Facebook, Instagram, Twitter, and LinkedIn. Also, make time to visit our website, anausa.org, for up-to-date information on Awareness Week, view resources and videos, study clinical trials, connect with others, and more. A special thanks to all of our medical partners who help make this week happen. Now, Dr. Ogilvie, if you'd like to turn on your camera and introduce yourself, we can get started.
Well, hello. Thank you very much for that introduction. I'd like to just welcome everybody to this webinar, and I thank you for your time. My name is John Ogilvie. I'm a professor of otolaryngology head and neck surgery at Keck Medicine of USC. We're here in Los Angeles. I'm also a department chair, and I've been caring for patients with acoustic neuroma and other tumors of the ear and skull base for well over 20 years now. It's really a privilege. Jennifer, why don't you turn on your video and your audio? It's really a privilege to have you here and to talk about the patient experience because it's so important to us, and we put a lot of effort trying to make it as good as it can be in a difficult situation. And so we have a patient navigator, Jennifer, who is going to usually be the first point of contact for most patients. If she's not the first point, she'll very quickly meet the patients and kind of help people through the journey. So I kind of wanted to turn it over to her. She's my partner in this. Jennifer?
Hello. All right. So my name is Jennifer Kelly, and I am the patient navigator for the Acoustic Neuroma Center at Keck Medicine of USC. I've been working with Keck Medicine for over 6 years, and beyond working at Keck, actually prior to that, I was a patient. And I had an acoustic neuroma. I was diagnosed about 10 years ago, and I had surgery. So I'm very familiar with the whole process of the acoustic neuroma journey. And so I'm going to talk to you a little bit about the role of being a patient, and also my role as now a navigator and helping the patients through the process. So first of all, when patients get diagnosed with this, it can be a very scary diagnosis, actually, because it's not a very well-known diagnosis. And sometimes when it presents itself, it's not always very easy for providers to kind of determine what's going on. And so it can be scary, and it also can be very frustrating, and it takes a while sometimes to get diagnosed. A lot of patients are diagnosed because they have hearing loss or tinnitus or maybe pressure in their ears, and other times it has to do with balance. But a lot of these symptoms actually are very invisible. And so it's not always easy for the patients to really explain their situation, and for all of their family members, providers, everybody around them to really understand what's going on. So being a patient navigator, helping you through the journey, and also being a patient myself, it is really helpful to have somebody who really understands. And everybody kind of has a different journey, but it's definitely great to have somebody that you can talk to that actually understands what they're going through. So once a patient is identified at Keck Medicine of USC, they're put on the scheduling either by, they're referred by themselves or they're referred by another doctor. As soon as we identify them as an acoustic neuroma patient, what we do is I get their information and I give them a call, and I have a quick introduction. And the first thing I do is give them my direct phone number and email address, so they have a direct way to get in touch with me at any time throughout their journey. And then I give them a little bit of background about our center and what we can provide for you as far as care. And then after, sometimes I'll talk to patients about their actual symptoms if they want to talk about it. It's helpful because if I know exactly what your current symptoms are going on, I know how to schedule you, and I know what is important to you that I can give to the provider, any information that's important. And sometimes patients are dealing with more than just an acoustic neuroma, so it's good that I kind of have a background, and then I can help with really taking care of them in every way. After,
If I can just chime in
yeah,
there. The other
absolutely.
thing that I know that you do that I really appreciate is you will tell, because you're in the appointment with me.
Yeah.
And so you'll tell me these things. And then if I forget to do it, sometimes patients don't ask either. Then you'll remind me, like when we're there with the patient. So I like that.
Yeah, we tend to, I work with Dr. Ogilai. I also work with quite a few other neuro-otologists and neurosurgeons, but they give me the ability to really communicate. And my job and my role as a patient navigator is to be the liaison between the patients and the doctors and the whole care team. And so that's what my role is. And throughout the whole journey from once you get scheduled until way down the line, if you have treatment or what follow-ups, I'm still involved with every step of the care. And with Dr. Ogilai, we also have Dr. Shibata, Dr. Doherty, Dr. Choi, all of these doctors, Dr. Giannotta, Dr. Cohen, Dr. Russin. These are all doctors that are taking care of these patients. And they all allow me to be involved and attend appointments whenever possible so that I can help. And that's very helpful to be actually in the appointment consulting with with the patients, because if I hear what the conversation is between the patient and the doctor, then I can fill in the gaps later on if there is any questions about anything that's going on. And I'm a very well-informed patient. I have a lot of general knowledge. Anything specifically, of course, I always send it to the doctors, as far as anything specifically for their case and their situation. I make sure that the doctors answer those questions, but all the general stuff, I'm able to help with kind of filling in those gaps, and that's important to patients. And there's no clear path for patients with this diagnosis, unfortunately. As you are first diagnosed, it's important, I think, in the role of the patient, I think it's very important to actually have that, go through that journey of education and really inform yourself about the diagnosis and the treatment options. And not all options you're going to be a candidate for, but it's good to just know all of those things and, just kind of understand exactly what it is that you're dealing with. And in most cases, this is not an emergency situation. In most cases, actually, it's, you have time to kind of decide on what is going to be done. So after, even though there's a lot of good resources, like the Acoustic Neuroma Association, of course, is one of the best resources that there is for finding this diagnosis. And then there's support groups, which are great as well. But I have to say, you have to take the support groups. It's great to talk to different patients, but take everything with a grain of salt, because everybody is so different with their journey. Even though they have the same symptoms and similar diagnosis, the outcomes are not always the same as far as treatment. So it's good to talk to different people, and it's great to get information as a patient, but you have to take all of that in and then kind of decide what's best for yourself. So besides scheduling the appointments and attending the appointments, I also help with medical records as a patient navigator role. I help with medical records. I help with any kind of disability paperwork if you were to have surgery and needed some time off. I help coordinate any follow-up appointments. The doctors are so wonderful to give me the flexibility to be able to coordinate multiple appointments in one day. And sometimes it may not exactly fit into our schedule, but we prioritize these patients and we streamline their care, and we do what we can to be able to schedule that audiogram and the patient with the doctor on the same day. We actually have a lot of out-of-town patients that come. And when we do have out-of-town patients, I can schedule, if they're coming for, let's say they're in observation and they're coming for a follow-up, I have the ability to schedule them for an MRI, an audiogram, to see the neuro-otologist and to see the neurosurgeon all in the same day or in a couple days, whatever they prefer. But it's helpful because we do have many patients that come from out of town, from out of state, even out of country. And so it's a great thing to be able to streamline this. And our Acoustic Neuroma Center, we really do make it a priority to be able to streamline these patients. And besides, all of the other, I'm always filling in all the gaps on the care.
One other point on that.
Okay.
What about if somebody gets a scan and sends it to us? How do we handle that?
Well, so nowadays there's a new, a lot of facilities now are becoming digital, and you can electronically transfer these. And fortunately, Keck has many platforms that we can send these images over on. So we have Ombra and LifeForce and PowerShare, and I've become very good at all of these. But we also have CDs that, we ask the patients to always bring in a CD to, for the results. But I've become very good at learning how to get these things transferred over to make it easier for the patients. So
and you'll bug me to look at it as soon as it comes in, and then call the patient.
Yeah, for our out-of-town patients that are having any type of just a follow-up care, if we're not able to provide a telemedicine appointment because it's out of state, but we still want to make sure that the patient's doing okay, I'll make sure that it gets reviewed. And we do have a whole team that reviews imaging as well. Part of our experience here at Keck is that we have a lateral skull-based conference that meets regularly with the whole team to go over imaging and talk about treatment options. And above everything, as a patient navigator, beyond all these things that I do, I'm also just a support. I'm somebody who could be there, and you can call at any time, ask questions, talk to me about your symptoms, but also, and I can help get you plugged back in, but I can just also give you some support. And so let's see. Once you've already been seen by our doctor with a consult, usually there is some kind of plan of care. So as we all know, or as you're learning maybe, observation is one of or surgery, or maybe radiation. And so in all of these cases, as a patient navigator, I'm following this and I'm helping to get this, continue the process. So I have, once you see the doctor, we will put in reminders in our system to contact you. So if it's observation and you have a 6-month MRI scheduled, we'll put in reminders. I'll make sure those orders are in for that MRI 6 months down the line. We will obtain your authorization if your insurance needs to be approved for those. We'll get the MRI completed. I'll make sure that the imaging is transferred over. We'll then get you scheduled with an audio and to see the doctor and go over the results. And throughout that process, I'll be there. I do attend as many follow-ups as I can. We have quite a big facility, so sometimes we have multiple doctors in clinic at once. So I can't be at 2 places at one time, but I try my best to be there for the patients. I always follow up with a phone call after if needed to go over things. And sometimes people are on observation and then they have a sudden change in their symptoms. And in that case, they can call me and we can make a decision on what to do. I can notify the doctor and they can kind of give us the new plan based on the new symptoms. So Um,
Jennifer, when they want to call you, where does it go? To some access center?
no,
You have to
directly to me.
punch multiple numbers to
Yeah,
talk to the
so no,
patient.
yeah, that what's nice about us is that it goes directly to my phone. So
Your
it
cell
keeps me
phone.
busy.
So she's
Yeah.
like always answering it in the middle of clinic. Yeah.
Yeah, I have a cell phone you can call or text on, so it makes it really easy for patients.
Yeah.
Um,
We're
and
really
then
lucky to have you doing all that, Jennifer.
thank you. Thank you. And then after, so some patients do end up having surgery, and I help them. I work with the surgery scheduler. I help with all the pre-op appointments. If there is anything that is needed, I just kind of make sure all the boxes are checked, and I make sure that they have everything they need prior to surgery. During whether in the hospital, they can still reach out to me. If I can, sometimes I will sneak over and actually visit patients in the hospital whenever I can. And after surgery, post-op appointments, I'm available, and I usually try to attend those as well. So I'm very active throughout the whole process. Also with the gamma knife treatment as well, anything that's needed, I'm just kind of there. And if you throughout the process, there's so many different providers that you're dealing with, maybe physical therapy, or maybe after surgery you have a dry eye and you need ophthalmology. All of those things, I can help just be there to kind of redirect you and get you to the provider that's needed and answer questions, get paperwork done, coordinate things. So basically, that's kind of my role in the whole thing. And it's a pleasure to work here at Keck. We have a wonderful team, and it's very special to be able to take my personal experience and then be able to really help other patients through a similar journey, and to be able to really be there and be the support, because it's a tough thing to do. So I think that's pretty much. I think we did a
That
pretty
was a
good job
lot.
talking about the roles.
Yeah, it's in many ways some of the things you do with the appointment scheduling and stuff like that. I mean, and insurance authorizations. I wish it wasn't so hard
Yeah,
that we needed a navigator for that. I mean, I'd say your more important role is the patient counseling and advising and support. But unfortunately, we all know, in the way medicine works these days, it's very challenging for patients to navigate the system. And that's why we have patient navigators. And we have patient navigators in our department for every part of ear, nose, and throat, not just for acoustic neuroma, but I think it's particularly important for this. And your expertise makes it extra valuable. So yeah, I really am proud of what you do, and frankly of the whole team and how we work together. I mean, we have doctors and audiologists throughout our satellites throughout LA. And so we're seeing patients with acoustic neuroma day in and day out. And we manage all the different treatment options, whether it be observation, stereotactic radiation, or surgery. And so we're not really biased one way or the other. We just want the best patient outcomes. And in many ways, Jennifer, you're the person that kind of carries that ethos through all the clinics and all the different doctors, and make sure that we do that. You also organize our weekly lateral skull-based conference, where we review all the images and make sure that a patient's concern that you may know about is addressed when we're looking at the pictures as a group. So I love that. So, what other questions do you have?
Yes, so thanks, Jennifer, for sharing, and Dr. Ogalai for your
thank
insights as
you.
well. We do have some questions that we have here, and you touched on a lot of them, but hopefully we can go a little bit deeper. You mentioned about helping with paperwork and even some insurance processes. We get a lot of questions to the ANA about insurance and how that works and things like that. So how can a patient navigator, what are they able or not able to help with in the insurance process?
Sure. So I don't directly get the authorizations. We're a big facility and we have a team that takes care of all of this. But what I do is I make sure that the team is aware of anything that's needed. I work very closely with an LVN. Our nurse is incredible and she will send out the requests for all authorizations and include me, CC me on all of these requests. And I follow them. So as the request is happening, it goes through the process, and in the chart, it'll show where we are at. And I keep an eye on it as it goes through the process. If I see that it's not moving, then I go directly to the authorizations team and I ask them, what's going on with this? I ask for status updates. So if the patient hasn't heard back from our team for an authorization, they can call me directly. I can get involved and I can see what's going on, what the status update is. If there is an issue, then I can, try to push it forward and do what I can do. I don't do the actual authorizations, but I am following every single patient. I am CC'd on everything, and I just continue to follow it until it's completed. And I have direct lines to everybody, so I can message people, and I'm very, I do whatever I can to kind of push things through, because sometimes these things get stuck for different reasons, especially depending on your insurance. Maybe they didn't, the notes were submitted, the clinic notes were submitted, but, they didn't get everything they needed. They didn't get the audiogram, and so they weren't going to, maybe approve an MRI because they didn't have the proof of hearing loss. So I'll make sure that the team gets what they need so that they can push any authorization through.
Great.
Yeah.
We know that a lot of acoustic neuroma patients might be seeking a second opinion after they have their initial consult. So how can a patient who might be a little nervous about talking to their first provider or first patient navigator about getting a second opinion, what's a good way for them to bring that up and questions to ask?
I think it's very important to have a second opinion. As I mentioned before, patients, even though they have the same diagnosis and similar symptoms, their outcomes can be very different, and their experience can be very different. And it's so important to get more than one opinion because, and it's also, not only is it important to get more than one opinion, it's important to, it's actually important to just kind of understand their situation and really feel that they feel comfortable with the provider that is going to be helping them with the treatment. If you're not comfortable with the provider, they might be a great provider, but maybe the personality doesn't work, or you're not able to communicate with them well. And I think part of it is part of the journey is finding a care team that you feel comfortable with. So I would encourage any patients when they're, we expect patients to get second opinions. We expect them that we know that we may be the first person or we may be the second or third team that they've talked to. And we just encourage them to, become educated, get that information, and find the care team that's going to work best with them and understands what their wants are, what their needs are, and, help them on their journey.
I mean, I agree with you. I prefer it when a patient gets multiple opinions. I mean, especially if they're going to undergo treatment, it's a big deal. And if there's a problem, and there can be problems, then I want my patients to have felt like they were in the right place for them, that they didn't miss any options. Nothing they didn't think, just rush into something. And so I greatly appreciate when they get multiple opinions. And I'll tell you what, there's almost never a reason we have to rush into anything with acoustic neuroma treatment. In fact, we are almost always observing patients right at the beginning anyway. So it's a perfect window to learn more. And frankly, it might be that after, the first time you may not understand the disease very well. And so it's good to go see different doctors. And then, every time you might learn a little bit more. And then together you get the full picture.
Yeah.
So how do they reach out to you, Jennifer, if they wanted to, come to USC?
Well, you can call me directly. My phone number.
Is it on the web or do they email
Yeah.
you or what do they do?
Yeah. Well, I guess our phone number is on the web, but it's
Okay.
323-442-8063. But you can call me direct or you can call our access center and ask for me, Jennifer Kelly, and they can they'll send you directly to me, and then I can just get you started on the whole process.
Yeah. And that access center, I think, is at the 1-800 USC
USC
Care.
Care. Yeah.
USC Care. Yeah.
Yeah.
Okay.
Great. And yes, you can find the information on the USC Acoustic Neuroma program on our sponsors page, where Keck is as well. You both mentioned about asking the right questions, and sometimes we know such a flurry of what is going on in the patient's mind when they're first diagnosed.
Right.
So Jennifer, as a patient and patient navigator, then Dr. Ogilvie as a provider, what are some good questions that patients need to be asking as they kind of set up their treatment plan?
Well, I'll start, I guess. I think it's important for patients to think about what their lifestyle is and, what is their ultimate goal with, with this diagnosis and as far as following it. And if they want treatment, what, the options, how does this look after observation or after surgery or after radiation? What are my goals? And, you have to look at your lifestyle. And I think it's important to ask those questions. Am I going to be able to go back to work? Am I going to be able to, get back to a better sense of balance? Some people are very imbalanced and they're having issues after surgery. And am I going to be able to go back to that? Or, how long is it going to take? So whatever their goals are, I think it's important to just kind of have a list of questions for the providers that helps them. And we don't know how everything is going to go. It's not there's no, like I said before, no clear path on how the outcomes are going to happen. But just having a good set of questions on what what is important to you and how are we going to get you back. The whole goal is to get you back to your life and get you back on track and live the best life you can. And so whether we're observing or surgery or radiation, it's good to ask those questions and see, depending on what your symptoms are, how you can get back to that normal life that you had.
I'll echo those comments. I mean, this is, it's going to be a benign tumor. And the problem is sometimes the treatments make you feel worse than you do before you undergo the treatment. And so that's a really important thing, that we don't want to rush into something that's going to make you feel worse. I guess if I was going to ask an important question, it would be, well, do we have to treat this thing, or can I just, take it with me when I leave this earth because of another reason? Because there's a lot of tumors that don't really grow very much, and we can just kind of keep following it. Other questions, sometimes we have young adults that have small children. And so another question is, well, would it be worth waiting a few years to treat this until the kids get bigger? Sometimes it's people's jobs. They're up on ladders a lot, or they drive a semi. And that is a lot different than somebody that's just kind of sitting in front of a computer most of the day. And so how is this going to impact my ability to work and make a living? So those are the kind of questions that I encourage patients to ask. I always end up asking them if they don't, because I know that a patient's not going to be happy if we don't take all of these issues into account when we come up with a treatment plan.
Great. Just a couple more questions here. We often see a lot of patients at the ANA who are juggling many different health issues that have come up, whether it's related to their AN or not. And Jennifer, you mentioned a little bit about being in contact with other providers, but how can a patient juggle those things well and keep alignment with their AN treatment and observation and any other issues they might be having? And does a patient navigator help them navigate that as well?
Yeah, that could be a challenge. And I've had quite a few patients that have other issues going on, and it's very important that we're aware of everything that's going on because that helps determine how we're going to treat this. And so our doctors are very good about sending notes to providers. Once they complete a note in clinic, we always try to ask them who referred you over to us. But besides that, who are the other doctors that are involved in your care currently? And we'll send over faxes and notes to those providers. And whenever I need to, I will jump in and help get records from other doctors so that everybody's kind of on the same page. I've had to coordinate phone calls in certain situations where somebody has multiple health issues going on that are all current, and we need to make sure that we're all lined up. And the doctors definitely they lean on me to make sure that we get all that information, and I coordinate those things so that everything is in the chart, and the patient, the doctor is aware and he can see what's going on. And also, that is definitely my role as the liaison, is to just kind of make sure that all of the different providers are on the same page. And at Keck, we're fortunate we have a full team, but you may be coming from another facility. Maybe you're coming from, another, like Cedars or Kaiser, whatever it may be. We have ways to get that information over into the chart and make sure that we're on track with getting all of that. But it can be difficult, and it's important as a patient. It is important to be organized with your paperwork and just at least know who your doctors are, have their first and last name, have the facility, the phone numbers. It makes it so much easier to help you and streamline your care when you have all of that information that you can just have at your fingertips and let me know, and then I can do my role of calling and getting the medical releases and calling and faxing and uploading. But if the patient is not certain where they had their last MRI, it can be very frustrating for the patient and for me and for the doctors, because we need to get that information. So yeah, as a patient, I definitely suggest to stay organized, make sure you're keeping track of doctors you're seeing, and always keep track of any of those hearing tests and any imaging. Those are the most important things to keep at your fingertips. Maybe have a file, have a folder, put it on your laptop, whatever, however it is. Or at least if you don't have all of the medical records, at least have all of the information, the contact information, so we can help.
I love it when patients come in with a folder or a binder with their papers and all the old hearing tests so I can go through them. I mean, that's incredible. We always give patients a copy of their hearing test so they can put it into their folder. The other good thing I'll say, Jennifer, is that luckily you're not the only person who has to who does the interfacing with other doctors, because if it's coming to surgery, then we want to make sure that the patient's going to be safe to undergo surgery and will be able to wake up afterwards. And so we always communicate with their internist or cardiologist and get their records, get a preoperative evaluation. And that's done by our surgery scheduling office. And every once in a while, somebody's kind of sick and I need to make a phone call and talk to those doctors personally. Then this information all goes to our anesthesiologist, and they have a pre-op clinic that will review that, and they usually end up calling the cardiologist if they're that sick, that they have a cardiologist, and making sure that everything is up to date and safe. So yeah, communicating with other doctors is a big part of an acoustic neuroma team. There's no doubt.
Great. And one last question for you. I know we mentioned and we talk about patients who decide to travel for their treatment and then what that follow-up looks like. And thankfully nowadays with all the digital options we have, they might not need to travel back to USC that often. But in the case they do, how often might someone need to come back and travel back to be seen in person? And how is that navigated in their process?
Should I?
Well, I can do that one if you want. I mean,
Yeah.
a lot of times we don't actually need to see them back. What I really need to see is their MRI and their hearing test. If it's like before treatment, let's say. So if I do an initial consultation and I examine them and their ears look normal, it's not like their ears are going to change on something I'm going to see on exam. So it's really the test results. If they're in the state of California, then no matter where they are, I can do a telemedicine appointment with them. And I can, see them. I can check their face. We can talk about stuff and it's an actual real appointment. If they're out of the state, then I can't do it because I can only see patients in states where I have a license. And I mean, I think I'm also in Texas, but I don't know about our other doctors if we have other states, but most states we can't. But we can still review the hearing tests and the MRI scans and get a phone call to them.
Thank you so much, Dr. Ogilvie and Jennifer, for sharing your insights and the process of using a patient navigator and what that looks like for the patients. We appreciate your time and sharing and appreciate the support from Keck Medicine and all that you do for the ANA and the AN community at large.
Thank you so much. I think hopefully you see our enthusiasm for caring for these patients. It came through, and I think we all feel lucky to be part of a pretty good team here. We're proud of our team members. We're proud of our patients, and we're really proud of the successes. And the vast majority of patients, I think, are very, very happy with the care that they get here. And I thank everybody for your attention today.
Thank you.
Thanks.